Hi, everybody. I'm Marguerite Rowe. I'm State Director of AARP Washington. Welcome to our Caring for Caregivers conversation. Here today is Dr. Kate Zhong from UNLV, which is University of Nevada, Las Vegas. She's a geriatric psychiatrist, and she's here to join us for a conversation on caregiving and brain health. Welcome, Kate.
Thank you, Marguerite. Thank you for having me here.
So, Kate, before we sort of jump in, because I think today we'll be talking about Alzheimer's and dementia a little bit and the impact for caregivers, and to hear a little bit about recent advances. Tell us a little bit about yourself. I know you are also a caregiver.
I am. My mother has dementia, and I have watched her declining, her cognition. So it's a very difficult journey for the caregiver to go through. Watch your loved ones losing their memory, losing their cognitive function. It's heartbreaking. At the same time, I am more motivated because I'm a geriatric psychiatrist. I treat Alzheimer's patients. I'm also a very passionate advocate for brain health. As a caregiver, and also as a daughter of a lady who has dementia, I know that I am at high risk for developing Alzheimer's down the road. As many of my family members asked me, and many of my patients asked me, so Dr. Kate, what can we do on the day-to-day basis so that we don't get Alzheimer's down the road? That's what the brain health is so important, because the good news is there's so much we can do to really reduce the risk and to mitigate the chance of us getting Alzheimer's.
So we should also mention that you are also an ambassador for us through the Global Council on Brain Health.
That's correct.
So just want to make sure that folks know that as well, because you have a very distinguished career. But let's actually start maybe at the beginning, if it's okay.
Sure.
I mean, I think people have heard about Alzheimer's, but they don't necessarily know what Alzheimer's is. So can you give us a layman's definition of what is Alzheimer's?
So Alzheimer's is a brain disease. Alzheimer's is what we call the neurodegenerative disorders. It was discovered by Dr. Alzheimer's almost 100 years ago when he saw his first, he described that patient as having fluid psychotic symptoms, memory problems, and then after he performed the autopsy, he discovered there are proteins built up in that patient's brain. And from there onward, the scientific world have gained so much more understanding about this brain disease, now we call Alzheimer's disease. It's really characterized by multiple symptoms. First of all, is obviously a lot of people know about is memory problem. Then the patient became much more forgetful. They may not remember their loved ones' names. They don't remember even recent activities, and their judgment tend to be impaired as well. As the disease progresses, it also impaired their daily functions. For example, their ability to manage finances, their ability to drive, their ability to even eventually eat and bathe by themselves. So Alzheimer's is a fatal disease. Some people may not think that way, but it is fatal disease. And it's becoming even more common as we, the society, are really marching into aging population. You know, every day there are 10,000 people turning 65, and age is the major risk factor for Alzheimer's disease.
So some of my work that I used to do was around epidemiology and population health. So one of the things that I noticed was that Alzheimer's has slowly become a leading cause of death for most of our population groups, whether you're white or black or Hispanic or Asian. And that really has changed over the last, I'll say, 10, 15 years? And is that because we're now diagnosing more of it and it's always been there, or are we actually seeing an increase in the rate of Alzheimer's?
It's really multifactorial. First of all, we are living longer. When you look at the overall life expectancy in the last, let's say, 40 years, really has increased dramatically. As people live longer, then the risk of becoming or developing dementia, Alzheimer's increased. When you look at 50 years ago, the average life expectancy would be around 40, 50 years old. So back then, there were much fewer Alzheimer's cases were diagnosed. So that's number one. And number two is that we, as a society, we have done a really great job in terms of the public education and prevention on cardiovascular, right? So, and I think there's been tremendous effort made in terms of helping people understand the importance of controlling the blood pressure and be mindful about healthy eating and stop smoking. Because of all those efforts, then the overall mortality of the heart disease, of the stroke, have also been declining, and people live longer and healthier, and therefore Alzheimer's, which is a neurodegenerative disorder, has now become much more prevalent because people live longer and because the other medical conditions are being more treated and more stabilized. And of course, with all the public education, I think that has really raised tremendously the overall awareness of Alzheimer's, and people are becoming more aware of if someone is becoming more forgetful and starting to experience symptoms of Alzheimer's. In the past, they might think this is just part of aging. But now with a lot of education, we realize that's not part of normal aging.
Okay, so I have so many questions to ask, but is all memory loss as you get older a sign of Alzheimer's, or is it, or shouldn't we expect that as we get older that there is some memory loss?
Well, as we age, our brain goes through the same aging processes as what our heart, our joint, our muscles all go through, right? So, what does that mean? We get wrinkles, our stature also shrink, we have more joint pain.
I don't think I can afford to get any shorter. Let me just say.
We have gray hair. So that's all part of the aging process, right? So same thing happened inside your brain. Our brain also goes through aging process in which that the number of nerve cells decrease, the connections between the nerve cells also became less sensible, the speed became slower, and also the area where the brain is responsible, particularly for memory, the size tend to shrink. So that may explain why that overall, that we can become a bit more forgetful. Overall, that our responding speed can be a little bit slower. We were not as fast, as sharp. And it's probably becoming a bit more difficult for us to multitask. You have to focus on one thing, otherwise you might walk into a room and say, why am I here? I don't remember. So that is part of the normal aging. So, and that is what we go through as we age. And that's not necessarily Alzheimer's disease.
Okay, good to know.
So there is a big difference, that's right. However, at the same time as we age, our brain became much more vulnerable to brain diseases such as Alzheimer's. And so the dementia, the Alzheimer's now has really becoming like a national priority with regard to understanding the causes, understanding how we can provide tools for early detection. And there has been tremendous progress made in the overall early detection, diagnosis, and treatment.
So let's, I want to make sure that we talk about early detection, sort of average age of onset, and also just hearing a little bit more as we go around when people, what people should be doing. But so can you talk a little bit about How does one get diagnosed as having Alzheimer's?
Great question. There are different ways of approaching these questions. First of all, if someone started to have memory problem, become much more forgetful, get lost, so on and so forth, cannot manage their bank account, that individual may not always realize she or he has problem. It's usually the family members. So it's very common for us to see that the patient was referred by the caregiver, or they have concerns about how mom and dad has not been doing so well. And because they are much more insightful, they could tell the differences. So we would get call from the caregivers. They want to bring their mom and dad to the clinic to have the memory checked. Right? So that's really usually the first sign. And when the patient started to experience those memory problems, it can become very frustrating to the family members. But that is assuming that the patient is living with their family members, or their family members are in close contact with them. For those people who live alone, who may not have a lot of social support, they may have to wait, or they may have already progressed to a very late stage before they ended up in our clinic. So by the time we see a patient, the overall severity of the disease can be really different, from very mild to very severe. So when we see a patient in the clinic, so we do a physical examination, we do neurological examination, we do blood work, and we may do the brain scan. We also perform cognitive or memory test. So that is a very comprehensive medical clinical evaluation. Why? Because there are many other conditions which may mimic Alzheimer's disease. That is, having memory problem, having cognitive issues, having impairment of their functioning. So that we want to rule out other potential causes for dementia before we can diagnose Alzheimer's.
So, I know that we talked a little bit earlier, and we talked about certain groups being at higher risk of Alzheimer's than others. For instance, women having a greater risk of having Alzheimer's versus men, or there are certain groups like Blacks or Hispanics that have higher rates of this point. Can you talk to us a little bit about the risk factors for Alzheimer's?
Absolutely. So, as I mentioned earlier, Alzheimer's is a neurodegenerative disease, and age is one of the major risk factors. So that as people get older, their risk increase, right? So when you take a look at a population in their early 60s, for example, the prevalence of Alzheimer's is around about 2%.
Okay.
And as they age, almost every 5 years, the risk double, the prevalence double. So by the time individual reach age 80 or 85, almost 40% of them will suffer from Alzheimer's. So that's one of the major risk factors. The other few risk factors include sex or gender. And you're absolutely right, women are in a higher risk for Alzheimer's. In fact, two-thirds of Alzheimer's patients are female.
And what is it that makes women at higher risk? Is it because they're living longer, or is it because they experience stress in a different way? And I sort of am weaving that in because I'm thinking of the role of caregivers, and I'm thinking about the stress that caregivers experience.
That is an area that tremendous amount of progress has been made, and a lot of studies have been devoted in women and brain health, women and Alzheimer's. So you're right, age, as we said, is one of the risk factors. Women do live longer in general than men, so that they have higher risk. And there are also a lot of studies looking at the role of hormone, estrogen. As women approach menopause, their estrogen level dropped, and there are studies indicating that estrogen hormone has protective effect on the brain health. So as the estrogen level dropped, then the risk of cognitive decline increased. And you're absolutely right that the stress is another risk factor for dementia, along with other conditions such as depression.
Okay.
And depression, we know that is highly prevalent among women, particularly female caregivers. So depression, anxiety compounding on their hormonal issues and their age, among other things. And actually, there is a biological differences between men and women just on their brain structure that potentially can also put women at a higher risk for dementia.
I have a feeling we could be here for a very long time talking, but wow, that's interesting. Well, but I know that your work, I know that you both do research, but you also spend a lot of time on brain health.
Yes.
And brain health, when we say brain health, we're talking about keeping our brains healthy.
Correct.
So what are some of the things that we can do, whether you are a woman or a man, to actually try to keep our brains healthy so that Alzheimer's becomes less of an issue, potentially, or that we're at less risk?
You know, a lot of us go to gym to stay physically healthy, right? And
Well,
they try to exercise or exercise to stay physically healthy. But I think the brain health is something that people are becoming so much more aware because people are concerned about the memory loss. And people want to do everything they possibly can to hopefully slow down the progression and to hopefully prevent Alzheimer's down the road. So the good news is there are a lot of studies, a lot of science being done on the overall impact of our lifestyle on our brain health. Let me just share with you a couple. So we know that age, gender, and ethnicity are some of the risk factors, but there is really nothing we can do about it, right? Choose your parents wisely, and but there are many other risk factors that you can modify, you can change, and you can be in control. So there are many studies looking at various risk factors. So now we have been focusing on 12 risk factors, and primarily in the following area. One is surrounding the cardiovascular risk factor, that is hypertension, obesity, diabetes, right? So that those are major risk factors as well for dementia. People who have diabetes can have as high as 4 times in terms of the risk to develop dementia, which is really astonishing. But the good news is if you have your blood glucose under control, if you stabilize your diabetes, that can reverse the risk. So that's very exciting. Similarly with hypertension, it's a major risk factor for dementia. But if you have the hypertension under control, and you can reduce the risk. So the other area is midlife depression. And again, we have touched upon that. So that's a treatable condition through multiple domains of intervention, right? So that's something very encouraging as well.
So I just have to ask, because today I think I also have to, this little detour, but I think I heard the term geriatric depression, and now you're saying midlife depression. Is depression different at different life stages, or are we just saying that because of where we are in the lifespan?
So depression is a clinical term, right? Which is characterized by many depressive symptoms. You know, you lost interest, you're not eating well, you cannot sleep well. when we talk about geriatric depression, it refers to people who are in the category of geriatric, usually 65 and older.
Okay.
Versus
So it's a
midlife,
lifespan.
it's really the lifespan,
It's
right?
the lifespan, and it's not so much the fact that it's a different kind of depression.
It's not. It's
Okay.
really the age.
Okay.
Yeah, categorically
good.
it's age.
Just curious.
Right. So when we talk about midlife depression, it means people who started to experience depressive symptoms or may have the clinical diagnosis of depression in their midlife, like late 30s to early 50s. So that's another major risk factors. And interestingly, like physical inactivity, people who have very sedentary lifestyle carry a higher risk for dementia. Understandably so, when they don't active and they are not eating well or eat too much, frankly, that's another risk factors. Hearing impairment is a risk factor for dementia, which is really fascinating. And they found that people who have hearing problem, hearing impairment, particularly those who do not seek help, who do not use hearing aid, and their overall chance of developing dementia substantially higher compared to those who either don't have a hearing impairment or who have hearing impairment but then get the hearing aids.
I don't think that's well known. So
Something
if
interesting,
people
yeah.
actually have a harder time of hearing, they should actually go to the doctor and
Absolutely.
be open to the idea of like hearing aids, because it's actually more than just hearing, but it's actually for your brain and having your brain work, right?
Exactly, because people who have a hearing impairment, in general, they have what we call a sensory deprivation, right? So you couldn't hear much, and then a lot of those people or patients then tend to become more socially isolated. And that just started the cascade pathway to depression and isolation and more stress and poor sleep, so on and so forth. So that all compounded together and increased the overall risk.
I think about this from a caregiver standpoint, and one of the challenges is not only making sure that your loved one is safe, but what I'm hearing you say as well is that, what's good for the body is certainly good for the brain. And what we want to do is to make sure as caregivers, as we're thinking about it, and for ourselves, is creating an environment where, you're eating well, you're physically active, you are staying socially connected.
That's the 6 pillars we're talking about, the 6 pillars for brain health. AARP really has playing a very major role in terms of helping people with evidence-based information, scientifically valid information, and educate the public. So this is part of the AARP Global Council on Brain Health that I was involved almost 8 years ago. And so this is an independent group, consists of the physicians, scientists, policymakers from all over the world. And one of the reasons that this was formed, because there were a lot of information out there on the internet. A lot of our patients just go Dr. Google, but it's very confusing. And how can people gain trustworthy information that they can really practice safely? So AARP really has formed this Global Council on Brain Health and review the available literature and reach the consensus and provide recommendations and tips on the healthy lifestyle, how we should be engaged in the brain healthy lifestyle in an effort to reduce risk for dementia. So in the last 8 years, AARP has published 14 reports covering various areas from physical exercise, sleep, nutrition, engaging your brain, music, so on and so forth. So it's a very broad range of our life and our lifestyle, and how by getting involved with a much more healthier way we can really take in charge of our own brain health and reducing the risk of dementia.
So ARP, as you've mentioned, has a lot of resources, and it's great to know that they're behind, pulling together the research so that we, as individuals, have a trusted source to go to. And we're really good at practical advice. So let me ask a couple of maybe, questions that we get often.
It's so important to be practical, isn't it? We can have hundreds of publications, all the data, all the chart, but when it comes down to it, every day, what can you do? Otherwise, there is going to be a big gap between the information and the data and day-to-day practice.
So I have friends, and I don't do this regularly myself, but who play Sudoku, who do word puzzles every morning, who do, that 10, 15 minutes every morning to all in hopes that it's good for brain health. Is that true?
It is good for brain health because, as I mentioned earlier, as we age, the brain ages too. The size shrink, the nerve cell decrease. By getting involved with what we call the cognitive stimulating activities, such as learning something new, pick up a new language, learning to play instrument, volunteer, or doing brain games, that can help brain to grow new nerve cells, to actually improve the neuronal connections. So there are a lot of studies indicating that people who are cognitively engaged, they have reduced risk for dementia. So that's one aspect of keeping your brain healthy.
It's good to know.
Of course, other areas will include, being active physically. That's very important.
So, we've talked a lot about risk factors and a little bit of what you can do. But I also know that because there are so many people who are caring for loved ones who have Alzheimer's, can you give us some recommendations around what caregivers themselves should be thinking about and doing for themselves and as they are caring for loved ones with Alzheimer's?
I can speak for myself to start. When caregiver first get into this journey, it's overwhelming. Even as a physician myself, you feel there's just so much you need to do, you want to do. It can be frustrating, can be depressing, and it really takes a big toll on caregiver, physically, psychologically, financially. I think as caregiver, we should first think about we have to take care of ourselves before we can provide proper care to our loved ones. And I think that we as caregiver, in general, are very devoted. We love our family members. We want to do the best we can. And as a result, it's not uncommon at all for caregivers to feel just stressed out, burning candles from both ends, and they have to take care of their loved ones, they have to take care of the work, they have to take care of their children, so that as caregiver, we have to be aware of our overall mental health, our overall brain health. So, of course, there are a lot of burden in terms of the demand of the time. So it is important to pay attention to your overall health. For example, when we get busy, we ignore our eating habit. We grab and go, and it may not be really that healthy. So I usually suggest to the caregiver, myself included, set aside some prep time for meal. Maybe just an hour per week. You can start to plan for the week and have some little snacks packed away so that you can grab and go. But rather than McDonald's and French fries, you can have nuts and almond and some healthy snacks, right? And another important aspect is sleep. I think we all have experienced sleep issues at various stages of our life, but as a caregiver, it really put tremendous demand on our overall life. And during the day, we are really busy, we don't think too much, but at night, you get really wound up. And caregivers have increased prevalence for sleep disturbances, so insomnia, difficulty falling asleep, frequent awakening during the night, and early morning awakening. So that's very common. And there are studies showing that a caregiver on average lost about 3 hours sleep per week compared to the non-caregivers. That also takes a big toll on our overall health, including the brain health. So be very mindful about your sleep pattern. Be mindful of practicing what we call the good sleep behavior. Keep your room dark and quiet and very little noise. And then be mindful with how much coffee you drink. Because when you think about the half-life of coffee, it's pretty long. So if you have a cup of coffee and lunch hour, let's say, it still remains in your system 8 o'clock, 9 o'clock at night. So that I try to be very mindful and stay away from coffee if I want to have a good night's sleep after lunch, no more coffee, right? So that's important.
How many hours of sleep should people be getting a night?
The recommendation is between 6 to 8 hours per 24-hour period of time. And of course, you may need just a little less sleep than I do, but the science pointed out that you should really get between 6 to 8 hour sleep. That is considered adequate.
I like to sleep, so that's not one of my major challenges. Getting good sleep is a little different, though. Sometimes it's
as
hard.
we age, our sleep pattern change, our internal clock change. So we tend to go to sleep early. We tend to wake up early too.
Will you tell us, what are you most excited about in terms of advancements in research and in treatment?
This is a very exciting time in the research for Alzheimer's. And we have new treatment. A brand new drug was just approved as of last year for the treatment of Alzheimer's. And before that, there were about 17-year gap or drought, we call that. There was no medication, no drug approved for treatment of Alzheimer's. So with the new discovery, with new research that really help us understand the underlying causes or pathology of Alzheimer's, which allow us to develop new treatment for Alzheimer's. So that is very exciting. And we have also advanced in such a great way in terms of our diagnostic ability. So Alzheimer's is diagnosed or confirmed by autopsy in the past.
Oh.
So as I mentioned before, that Dr. Alzheimer's discovered and described the toxic protein, the plaques and tangles in the brain. So that has been the gold standard to confirm Alzheimer's disease, autopsy. That's a little too late, isn't it? It's a little late. That's right. And so in the last decade, we have made great advancement. First is brain scanning or brain imaging that would allow us to see the toxic protein inside the brain.
That's great.
That's great, isn't it? So that's the way of us, physicians, can diagnose Alzheimer's disease while the patient is still alive. That's what we want, isn't it?
Yes. Yeah.
And then that was fantastic. However, that is very expensive, and insurance does not cover. It's about $4,000 to $6,000 for a brain scan. So we have been making great strides identifying or discovering other diagnostic tools. So it's very exciting. Now we are at the cusp of having the blood test available for
So-
Alzheimer's.
Let me just go back for just 1 second because you said that there was a new drug that was available. So it has been FDA approved and it is now available?
Correct. So it was approved by FDA. It's called Leqembi. The manufacturer is Eisai. So it is what we call a monoclonal antibody. So it really clears the amyloid accumulation in the brain of Alzheimer's patient, result in the clinical improvement of the symptoms. It is available, and it is covered by Medicare.
Okay.
And patient
great.
that's great, exactly.
That's great.
Yeah. So requires the intravenous infusion. So and every 2 weeks. So it's a little inconvenient. However, it really offers great benefit to the patient. And we have another one just hopefully coming very soon. It's another drug in the same class, but it would only require the infusion once every month,
Yeah.
less frequent.
Yeah, yeah. So it's great to hear that we're at a stage where the advancements may come more rapidly and that there's actual treatments now available.
Indeed, that we have been following the overall development of Alzheimer's drug in the last 8 years very carefully. We publish annual report on the Alzheimer's pipeline. So there are about 174 clinical trials ongoing, studying 120-some new drugs. So there is a lot of excitement ahead of us.
I can see your passion, your eyes light up when we talk about the research and treatment. So I'll just say we're so lucky to have you working in this field, and so happy that you're part of the AARP family. So
I just want to give a big shout out to AARP and their effort. And we know that research requires participation of our patient and our caregivers. So that I think providing timely, valid, and scientifically sound information to caregivers and patient and your members is really critical.
Kate, thank you very much for joining us today. I have to tell you, there's so many more questions, but maybe we can do this again another time to go through all the rest of the questions. I'm sure that everyone will find this to be very helpful, and just really appreciate all the work that you are doing to advocate on behalf of others and advocate for us understanding and being more cognizant of brain health. That's an important thing. For more information around caregiving, you can go to our website, aarp.org/caregiverswa, where you'll find more information and links to information, including those on brain health and caregiving. Thank you very much.
Pleasure. Thank you. It's an exciting time. With all the new treatment coming on the pipeline, it's great. Thank you.
Thank you.